I would like to introduce Michal Goldstein. Michal Goldstein is a registered social worker working at Dynamic Health Clinic in Toronto, where she sees adults for individual, couples, and group counseling. She is also the founder of Creating Connections, a play-based therapy practice in Toronto, where she works with children suffering from mental health and behavioral challenges. She has over a decade of experience working with caregivers to support them in improving their ability to cope with the challenges inherent in caring for a loved one. Michal has developed numerous workshops and support group programs utilizing knowledge of interpersonal neurobiology and mindfulness techniques to support individuals suffering from physical health, mental health, and parenting challenges. She is passionate about bringing evidence-based practice to the forefront of the clinical social work field. Michal knows both firsthand and from professional experience the challenges that come with caring for a loved one with a physical and mental illness, and she is grateful for the opportunity to bring more awareness, education, and support to this community. Thank you so much, Michal, for joining us today. I'm going to pass it over to you, and I hope everyone enjoys the webinar today.
Thank you, Cleo. So thank you all for joining me today and starting your journey in educating and strengthening yourself as caregivers. I'm so glad to be back here with Scale and to be involved in the amazing work that the OCO does. And I'm so happy that you were able to access this amazing resource. So today's webinar will focus on the development of yourselves as caregivers in the emotional impact this has on yourself and in your relationships. We'll also discuss how utilizing the perspective of your loved one, understanding it and utilizing it can help you make shifts within your perspective and in turn within the relationship that you have with your loved one. It's really so commendable knowing how busy it is to be a caregiver, that you're taking the time today and throughout this program, whether you're watching this now or live or through a video later on, but taking the time to give yourself support so that you can be ready and more ready and more able to care for your loved one. As you know, mental and physical health is an issue that it affects not just yourself, but your entire family, and that there's nobody left untouched when, somebody is suffering from a physical or mental health challenge. So as we begin the workshop today, I wanted to invite you to take a look at this image and bring up a mental image of your family. If you had to choose one person within your family or extended family that you would place in the center of this image, think for a second to yourself, who would that person be? The majority of individual within your life circumstance as caregivers would say that for the family member or the loved one, the illness has actually become the center of the circle, where so much of your life, your family's life, your time, your energy is taken up with attention towards your loved one with the illness. Having myself lived with a loved one with a mental and physical illness, I can speak personally to that effect, that how much time and physical and mental energy, your worries, your anxieties, your doubts, your entire headspace revolves around this individual. And so much of your day-to-day focus is just on managing the care of your loved one, managing their emotions, managing just physical care and emotional care of them, and understandably so. For the purpose of our time today and for the coming weeks, I want to invite you to make a shift, to imagine yourselves now as the individual in the middle of this circle, the individual in red, and imagine how it would feel. Just take a second to imagine how it would feel if you were actually at the center of this circle, rather than your entire focus and attention and your family's entire focus and attention being on your loved one. Look at this image on the screen now and imagine how it would feel for your entire focus of your care, your worries, your concern, and your attention were on you. It's a bit strange, isn't it? It's somewhere I'm sure most of you have not, been for a very long time, if ever. But what we want to explore here within the next few weeks together is that by shifting the focus on yourself during this time, you place yourself in a better position to give to all the people around you, including your loved one, whether it be your spouse, your parents, your siblings, your children, whether they suffer from a physical or mental health issue or not. But by caring for yourself, you can actually care for everyone else in a much better way. So when we look at, how do we do that? Well, the SCALE program has so many different resources in terms of being able to access this centric, self-focused mentality. So we have the live webinars every week, a Tuesday at noon. There's online coaching groups, both at Mondays 12 to 1 and Wednesdays 6 to 7, where we will further, discuss what's talked about in that week's webinar, where we'll, use real life examples and allow you to connect to each other on, on some of these issues. And then we also have the one-to-one phone counseling, where, as you can see the times here, where you'll be able to address, more specific issues that you have going on in your life within your caregiving role, or within, as it affects your life. And you'll be able to do that on a one-to-one basis with either myself or another one of my colleagues. This program is also available in French. So their online group coaching sessions will be Thursdays 7 to 8. And the one-to-one phone counseling in French will be provided by a different therapist who is French speaking. And these are the one-to-one phone counseling times available. Throughout the webinars series, we'll be talking about, your role as a caregiver, some ways in which you can understand your experience, understand yourself as you relate to your loved one. How can you overcome the feelings of sadness, guilt, anxiety, and anger that often plague individuals who are caregivers, and how you can move from, that place, or incorporate to that place, becoming a more mindful and self-compassionate caregiver. So we'll focus on uncovering your strengths and engaging as well in self-care practices and a self-care mindset that will help support your maintenance of everything that you gain throughout the program as we get to the last weeks of the program. So just to, I think we spoke to this already, but just to elaborate that the online group coaching sessions, there is a guided awareness practice that we might do. We'll explore the webinar topic. You'll be able to have the support of, your other caregivers. And through the one-to-one phone counseling, you have, the ability to spend a specific time on problem solving for specific issues that you're dealing with, which we already spoke to. So let's get right in and start talking about what are the different stages of the caregiving journey, and some of the commonalities that you might be experiencing at different stages of this experience. So we'll discuss each one in more depth as we go on, but the stage one is categorized as the catastrophic event, meaning the time in which you get placed in the position of caregiver, so to speak. Stage 2 is when you take on that role. So that's really being able to reach a place where you're incorporating the role of caregiver into your life and really coming to terms with certain areas of it. And then stage 3 is about moving into advocacy. So actually being able to move outside of yourself and outside of your experience within the role of a caregiver and being able to give towards others. Now, these stages are not linear, right? Some of you might be in stage 1 or 2 or 3, depending on how long you've been in this role, depending on other factors in your life. And it's definitely normal to sort of move backwards and forwards within the stages and cycle back around within them as you go on in your caregiving experience. Often if there's a new diagnosis, a new hospital stay, that will kind of shift you back to a stage 1 type of experience. But I'm hoping that with more understanding into these stages, the goal is not to sort of assign yourself to a stage, but more to, listen and hear if any of these qualities of each stage resonate with you, and perhaps help you feel a sense of comfort by the knowledge that you're not alone in this experience, and that these are all emotions that are completely expected and normal to experience as a caregiver at each stage. So the stage 1, as we said, is called the catastrophic event. And this stage is categorized by uncertainty and fear. It's a state of crisis, shock. You might be in denial or disbelief over, what you've discovered about your loved one or the role that you now need to fill. There's the sense of grief over, perhaps the relationship that you had expected to have and may no longer have, or might realize you're never going to have. A sense of loss about these relational aspects. There's also, many people experience feelings of guilt and shame over, senses of resentment, perhaps, the sense of hoping that it would be something else, your relationship would look differently. All of these aspects contribute to how a person feels during this experience. And then there's, also this traumatic response, so to speak, this feeling of like a flight or fight experience, where you're just like, I need to get away from this. I can't do this, right? Some of you might have felt or feel, worry about the future and anxieties in relation to even trying to come to terms with taking on this responsibility. There's also a objective impact to this time period. You have the impact of financial loss in terms of maybe more childcare, more cleaning help, having to pay for a care worker, different financial expenses that you now need to incur because of this new stage of your life. There is disruptions to your family life. So it might be whether, constant hospital stays or doctor's appointments or visits to your loved one that need to take place and sort of impact your normal flow of family life. There's also impact to your social life, whether it's a lack of desire to go out, or, feeling like your friends don't understand, feeling isolated from your social circles because you don't feel like they can be as supportive to you or understanding of you in your current experience, which could be really isolating, which again is, why these group programming is so important, because it allows you to connect with other people who do have this sense of understanding of your experience. There's also an impact to your physical care, because you might not have the time to attend to yourself in the way that you used to, or the energy to, maybe prepare your meals properly, or there's a lack of sleep, which either can come about from a sense of anxiety, or, you're not able to sleep because you're so worried about what's going on, or, you're just so occupied or needing to do overnight shifts with your loved one. And so, that's significantly depleting and also significantly contributes to all those feelings of chaos and uncertainty that you're feeling emotionally, is just compounded in terms of, not having the physical care areas maintained. And, we'll talk more about some of these emotional aspects and how, we can address them and how we can move forward into further stages in the caregiving process. But suffice it to say, there's a lot going on during this stage. There's a need for support and information and resources. Often there's such an unknown in terms of not really knowing anything about your loved one's illness. And this learning process, I remember when, I discovered about my loved one's illness, I remember the doctor coming in and giving me this like binder, like this big, with like, oh, don't read it all at once. And you're just so overwhelmed with this lack of knowledge. And how am I ever going to know what I need to know in order to care for my loved one? So, there's a lot going on in terms of that. And we try to sort of throw different band-aids at a situation, but not really necessarily knowing in this stage what's needed and what could be helpful and what's required, right? So there's a process of discovery, both about the illness and about self-discovery in terms of how do I come to terms with some of these emotions. But what's so important to know, whether you're kind of looking back at the stage or whether you're still in this stage, is that so much of this is a part of a normal sense of experience that that somebody as a caregiver has. And, there's nothing unusual about feeling shame over the fact that this is your loved one, right? There's a sense of, needing to accept the reality that it's not just, an experience that I'm having, but it's an experience that exists within my whole family. It's an experience that's going to impact my whole family, and it's going to shift the way things look in my family. And that's okay. And that's normal. And it might change the energy that you have for your other family members. And it might change the way that you can engage in your job or the way you can engage with your children, right? So there's so many different impacts, and it extends to all areas of your life, right? The other piece is the sense of being able to engage with yourself in all stages of caregiving, but specifically in this one, in a relationship of forgiving. So the slide, if you can't read it, says, forgive yourself, you are not perfect. Show yourself grace, you are still learning. Show yourself patience, you are on a journey. And this caregiving journey, and that's why we call it that, is about, looking forward and looking in this journey at the knowledge that you can continue to gain, both about your loved one and their condition, and in addition about yourself, right? And what you're able to handle, what you're not able to handle, what areas are hard for you. As I mentioned earlier, what are your strengths? And this allows you to come into yourself as a caregiver, come into yourself as this new role that you've, whether, agreeably so or forcibly so, been put into. So that's, I believe that's something that this quote you've received on the handout that we've given. And it's a great reminder of, being able to engage with your experience, your journey in a forgiving way, in a way of understanding of yourself and of the challenges that are involved in having all of these emotions, coming at you suddenly in a way that you weren't necessarily expecting to have, and being able to forgive yourself for any, imperfections that you have as a result. So we're going to move into the next stage, which is taking on the role of a caregiver. And this stage really looks at, learning to how you've come into yourself of learning to cope, right? When you move into this stage, you begin to learn to cope with some of the emotions that we discussed just now that come, very strongly in the beginning of your role as a caregiver, but that you start to gain knowledge about, you start to gain experience of, you start to get a sense of the nature of the crisis. So there's a little bit more predictability, a little bit, not definitively, but a little bit more predictability in terms of knowing what to expect from the situation. Not necessarily, specifically, there could be medical crises that still come up. There could be interactions with your loved one that you're like is constantly changing, but you have a little bit more of a handle and an expectation of, what things are going to look like, which really does make it a lot more manageable. In addition, there's the knowledge, right, that you've gained by the time you've come into this stage about the, your loved one's mental or physical illness that really support you being able to cope with some of the emotions that come along with it. There's also a place of acceptance in terms of the grief, right? The grief that comes along with the loss, or the loss of what you've had to give up. A lot of caregivers have to really give up important parts of their life, right? Whether it's, I know caregivers that have to give up their job because they're no longer able, or cut their hours, or move into a different profession because they're not able to longer do what they had been doing before and care for their loved ones. So there's this coming into a place of acceptance for the changes that have to be made, and acceptance for, the nature of your loved one. There's also a restructuring of your relationship. So as you come into this acceptance, you also learn how to work with your loved one differently, right? So while, at initial stages of the caregiving journey, each thing that you're coming to realize that's going to look different is really emotionally overloading as you come into this next stage. And if you're not in that stage, I hope this will be kind of inspiring hope in you, that as you come into this stage, you learn to restructure your relationship to look at what is and what can be, and not what we want it to be and what we need it to be, right? And you're fighting this fear of anguish and powerlessness, right? By coming face to face with what your loved one is today, and what is possible and what is not possible in terms of that relationship. There's also, you're fighting this fear and powerlessness in terms of dealing with your health, the healthcare system, which is often a really big challenge. You're finding places of support, right? You're finding different, like the OCO, and different supports within your loved one's specific experience. And you're also learning to navigate the system, the healthcare system, a bit better. Stage 3 is about moving into advocacy, which, we categorize it as this, not because that's a requirement of getting to the next stage, but it's about taking a sense of ownership of your loved one and their condition. It's about taking a sense of ownership of, your life again, your support systems, getting into a really clear flow within your life. And it's sort of like the culmination of that piece of acceptance, where not only are you able to accept the role that you've been put into, but you're actually able to see benefit in it. Benefit to the sense of being able to utilize your experiences to give to others, to support others. The OCO has a wonderful peer support program, which is a great way to move into advocacy, where you can, provide support for those caregivers who are still in stage 1, or maybe very, very new to their loved one's condition. And this is actually extremely encouraging for you to feel meaning and purpose in what you've went through. So we flow and we learn through these stages, both to move through the stages, right? The sense of self-growth as you move further and further through the stages. But that focus on self-growth, and that focus on the relationship with your loved one, and shifting what that looks like, that piece actually encourages the flow through the stages. So, that's why I said in the beginning of the program, is that engaging in these programs is actually a way to move yourself forward. It allows you to gain more understanding of yourself and your experience. And that's a really crucial component in being able to flow forward in the stages. So when we talk about self-growth, we talk about the different levels of understanding that you gain as you move forward. And when we talk about relationship skills, we look at, how do we learn to relate to your loved one in a different way, not just as the one you're caring for, but as an individual that you want to understand and understand their experience. And that's a really big part of how we move forward in that aspect of the caregiving journey. It's important to remember that you're living through a really challenging experience, but so is your loved one, right? And so much of, so much of being able to come into this new relationship with your loved one is about understanding their perspective and their experience. Because what that allows for is a healthy communication and a place where you're able to start shifting the way you see them and the way you see your experience. So we'll talk about this more now and get into more depth. So if that wasn't clear, don't worry. We're gonna speak a lot more about that now. So often, a lot of our challenges in our relationship with our loved one come into play with, my emotion versus those of my loved one. How does the way I'm feeling about the situation impact my loved one? And so remembering this piece of they're having a very hard time right now as well. And how is that going to impact, their interactions with me, and then in turn, my interactions with them? It's this cyclical process. When you think about how stress impacts your perspective overall, right? Like you can, think about it in a different area entirely, whether it's in your job and when things are stressful, and how you perceive the people around you and how you perceive, the job that you have to now do. The same thing comes into play in terms of your relationship with your loved one. How much all the emotions that we spoke about that come into this caregiving journey, how much they impact not just yourself, but they impact your loved one and they impact the relationship there. And so it's so important to be mindful of, what are the things that are contributing to my perspective? What are the things that are causing me to feel a certain way about my loved one and about the experience, right? So one thing that's has a really big impact is other people's perspectives, right? How do other people's perspectives impact the way I feel about my loved one? I'm sorry, 1 second, the slide's just not moving forward. Oh, there we go. Okay. Hope it stays. Okay. So the impact of other perspectives, I don't know, if any of you can kind of relate to other times where, other individuals in your life have maybe made comments about the way that you're interacting with your loved one, different things that they might not approve of, different ways of interacting that they might not think is the best, and how that impacts you. So, these are some thoughts that might in your mind be challenging you, might be in your mind affecting the way you think about your loved one to begin with. But then hearing other people actually say these things, they should just pull themselves up from their bootstraps, meaning they can do it. And this is often something that comes in a lot when you're caring for somebody with a mental health challenge is, they can do it if they just push harder, right? Why are you babying them? If you push them more, they'd be able to do it. Or, why are you why are you infringing on their independence? Or, they're able to do more if you just stop babying them. So all of these comments, they might be things that you're already thinking because of your own perspective or perspectives that you've been given, throughout your youth into adulthood and throughout your life. And they also can get impacted by what you're hearing now on the ground. So it's important to sort of, be mindful of that, be aware of the fact that this is going to play an impact when you're hearing other people say that. And so that awareness, just even the simple awareness that other people are giving that perspective, can really make a difference in terms of not allowing it to affect you in the same way. So when we look at, so how do we shift perspectives? How do we look at what a true perspective of a situation is? So, if you can see the meme on the screen, it says if physical diseases were treated like mental illness. And there's an image where it says, I get that you have food poisoning and all, but you have to at least make an effort, right? So when you think back to these comments that you might be hearing, whether within your own mind or whether, from other people directly, you think about, is this how I look at things? Is this how I look at my loved one's experience? And this is the case whether we're talking about a physical or mental illness, because often so much of, the experience of your loved one who has a physical illness, often mental illness really becomes a big component in that, and really starts to impact the way that they see their life, how they're feeling, whether they, fall into a sense of depression over what they're, the prospects for their life because of their physical illness. So, mental illness is really so tied in, whether it's your loved one has predominantly a mental illness or a physical illness. And so it's about looking at, the last image. Have you tried, not having the flu while, the person is throwing up, right? Like, it's about shifting our understanding of what are these expectations that we have from our loved one? What's our understanding of their experience, and how is that affecting the way that we're interacting with them? So I just wanted to read you a few testimonials. So these are quotes from, individuals who suffer from either a mental or physical illness, and just speaks to their experience and how this experience impacts their ability to function in the world. Mental illness feels like you're losing control of you. You don't know who you truly are because this disease controls you and takes over your emotions. It lies to you and tells you that you are worthless. You wonder if things you do are your personality and your disease or your disease. And on top of all of these oppressing feelings, society stigmatizes us as violent individuals because of the publicized actions of one or two people with mental illness. Very few of us are actually like that. And that is how we are treated, and that is how we are seen if we are ever to reveal our mental illness. So imagine that these are some of the thoughts that are often going on in the background of how am I viewed now because of my illness? How am I understood by other people? Another testimonial, I'm in constant pain and I can't think through it. They want me to do so many things they're telling me that I should do, but I'm just too tired. Just getting up is hard enough. Another testimonial, I used to be who they looked up to, and now they're changing my bedpan. I can't do anything I used to do. Do you know how that feels? Being able to kind of think about these perspectives, incorporate them into our mindset, to think about what it feels like to be poked and prodded, and these ongoing fears, the same anxiety that you have, your loved one has, right? What's going to be with me? What does this diagnosis mean? They're experiencing through these same stages, right? There's the experience of the grief and the loss that comes into play for your loved one themselves when they discover their illness, right? It could be that they've been battling with the knowledge of the illness for longer than you have even known, and what impact that makes on them that they've hidden that for so long, right? So we have, it's just a matter of kind of thinking, how does it feel to them, the way that we're interacting with them, their personal experience, and just to imagine how hard it is for them, how exponentially hard it is for them when, what comes across on our face, what comes across in the way that we look at them or interact with them is not necessarily always positive. And again, we have to look back at that forgiveness piece, but that doesn't mean that we can't, try to move forward and work forward into coming to a better understanding of them and looking at them differently. Now, part of that shift in understanding is understanding what are these behaviors, because it becomes so challenging to present this, loving, happy front with our loved ones when things are so utterly challenging, when the behaviors that they are displaying, which they don't necessarily mean to, but that are impinging on our ability to function in life, becomes so difficult. And so how do we maintain this sense of awareness of their experience and awareness of where we want to be in terms of our relationship when these behaviors are so challenging? So if you see the image of the iceberg here, often behaviors can be explained like with the analogy of an iceberg, that what you see on the surface about your loved one, the behaviors they're displaying, the challenges that they're presenting you with, these are just the tip of the iceberg. This is just the top, right? The surface. But what's actually happening underneath the surface is a massive experience of emotions, right? They're not just refusing to take medication because they want to be difficult. They're refusing to take medication possibly because of all the whole impact that it has on them to think of themselves as somebody who's ill, as somebody who needs medication. They're constantly, asking for your attention and not giving you, a moment of time for yourself because they're feeling so afraid and alone, right? And these are some of the possible understandings, that wealth of understanding that exists under the surface in terms of what's popping up in terms of these difficult behaviors. So when we look at the behavior that our loved one is presenting, when you think about some of the challenging behaviors that you're currently dealing with, think about what could be some of these emotions that are underlying these behaviors. What could be some of the emotions that are contributing and sort of bursting out from under the surface that look like these difficult behaviors? Because when we take it from that lens, we're able to connect to our loved ones with more empathy. We're able to connect not just to the experience of the behavior, but to the experience of the emotion underlying the behavior, and to relate to our loved one with empathy. I want to show you now a clip by Brene Brown on empathy. It's a really great way to understand, what it is that your loved one is experiencing and how to relate to them differently.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, "I'm stuck, it's dark, I'm overwhelmed." And then we look and we say, "Hey, you can climb down. I know what it's like down here, and you're not alone." Sympathy is, "Ooh, it's bad, no, you want a sandwich?" Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, "I don't even know what to say right now. I'm just so glad you told me." Because the truth is, rarely can a response make something better. What makes something better is connection.
let me just, describe for a minute the parts that are relevant to how we are, what we're discussing now in the rest of the presentation is just in terms of the piece that contributes most to an understanding of, your loved one, and this ability to engender empathy for them is in terms of what we spoke about up until now. And then the piece about being able to take that empathy and being able to bring it into your interactions with your loved one to create shifts there, that looks at your ability to be vulnerable with them, right? So vulnerability is about looking at your experiences, right? Your experience of pain, all the feelings and emotions that we've talked about until now that's come into play with your caregiving journey, and being able to relate to that piece that exists within your loved one, right? So accepting, I have strengths, I have weaknesses, my loved one has strengths, my loved one has weaknesses. It's the ability to see those strengths, see those weaknesses, be okay with them, and connect to that place with your loved one. And that's what she talks about. It's about accepting, Brene Brown, I'm saying, that's what she talks about in the video, is about accepting your place of humanity, your place of vulnerability, and being able to just come and be with your loved one in their experience of pain, right? And allowing yourself to uncover the pain that's enclosed within this process, right? It is a painful experience. We are suffering as caregivers to all these shifts and all these changes. It's hard. And that's why you've accessed the support, because you're looking to make changes in that area, and you want to, get to a place of support and flow through these stages in the way that you want to. But in terms of your relationship with your loved one, being able to access that place and being okay with accessing that place allows your loved one to be able to relate to you, that this is something that they can now allow themselves to experience because they see you experience. It's a way that you can model for them, how we can relate to our experiences and how that can help us relate to another person. One thing Brene says in the video is, rarely can a response make something better. What makes something better is connection. It's not about what you tell your loved one. It's not about the words that you say that's going to all of a sudden make things differently, better for them and different for them. It's about the fact that they can feel connected, the fact that they can feel heard and understood because there's somebody else there with them in their challenge, right? And that's something you'll see and understand more as you watch Brene's video is how do we come into this place? And I have this video for myself on like auto repeat all the time, because you need this constant reminder of the fact that, that's okay. That's okay to be in pain, and it's okay to not have the words to say to your loved one and not have the answers, but just about this piece of connection and this place of being there for them that makes the difference. So, when we look at how some skills in terms of having communication with them, the biggest piece is not to assume that we understand what their experience is. Don't assume you know what they need. Don't assume you understand how they're feeling in a specific situation, or why they're refusing something, or why they're being difficult somewhere. Don't assume that you know the worst part for them. What is the worst part of what they're experiencing, right? Well, for you, it might be one piece. For them, it could be a totally different piece, right? And so not to assume these things, but to ask, but to be able to come forward to them with this place of vulnerability and say, like, what? I want to understand how you're feeling. Like, what is it that you need from me? What can I do for you? How can I help you? Because so many times as caregivers, we want to give everything to our loved one, but the things that we're giving are not actually what our loved ones need, right? It could be all they need for you to do is spend, the hour that you are there with them visiting for the day, let's say, sitting with them and having a coffee, as opposed to, taking care of their dishes and taking care of their laundry and taking whatever it is that you're doing, right? Or making their meals. Or it could be all they want is to just know, to relieve their anxiety. Okay, I have food prepared for me for later tonight, and that's what they need. But taking this stance of not assuming and being able to be vulnerable to the place of asking, what is it that you need? What can I help you with? How can I help you? What's the worst part for you? How can I be supportive to you? That's such an important part of connecting with your loved one. And then finding this place of serenity and being able to say, as I'm sure all of you have heard this quote, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. There's a very encouraging process that's used in the STEP program to be able to come to a place of understanding and accepting the things that you can't change. And that's often a big piece of what holds so many people back in terms of their relationship with their loved one, is trying to change all the things that they want to see, the changes that they want to see happen within their loved one. And often they're not, again, attending to the things that their loved one actually needs. So it's being able to accept the limitation to the changes that you can make in your loved one's experience. And this is something that we will talk much more about in the coming weeks. But, just to kind of start to take on the perspective of being able to accept that the way that we view our loved one and the way we're relating to them, that there are shifts that can happen there, whether it be in perspective shifts or whether it be in communication shifts or vulnerability shifts. But these shifts can actually very much impact the way that we experience our loved one. And as we move forward into next week, we'll talk about, more about understanding how your stress as a caregiver, how your stress and your experience impacts your ability to do this, to incorporate all these relationship skills. And when we can get into a deeper understanding of our stress, how to impact it, how to change the dynamic there, we can then utilize these relational skills to a higher level.
Thank you, everyone, for attending today's webinar. We will be back next Tuesday, February 9th, and we're going to continue the series into week 2. So we're going to explore how caregiving stress affects you. So get into that side a bit more. But we hope you can tell others about the work we do here at OCO, and you can connect with us and other caregivers through our Facebook, Twitter, and Instagram pages. So thank you again, and always feel free to reach out if you have any questions.